This video will be on the cardiac cycle. It will be the first part of the four-part series on the cardiac cycle. And it will cover diastole, which includes ventricular filling and atrial systole. The goal of this video is to clearly explain the events of ventricular diastole, showing how the ventricles fill first passively and then actively during atrial systole, preparing the heart for contraction. So let's start the cardiac cycle with ventricular diastole, which is the relaxation phase of the cardiac cycle. The purpose of this phase is simple: to fill the ventricles with blood. So as blood returns to the heart, both the atria, the right and the left, gradually fill. Their pressure rises just enough to become slightly higher than the ventricular pressure. This rise in atrial pressure opens the atrioventricular valves. And this allows blood to flow passively from the atria into the ventricles. So there's going to be a passive flow from the atria into the ventricles. Here, from the left atrium to the left ventricle. This early part of diastole is called passive ventricular filling. During this time, the ventricles are relaxed and expand easily, drawing blood in almost effortlessly. In fact, about 70 to 80% of ventricular filling occurs passively during this phase, even before the atria contract. As the ventricles fill, the pressure between the atria and ventricles gradually equalizes. This completes the passive phase of ventricular filling. So, now moving on to the active filling. This is atrial systole, which occurs in the late diastolic period. Now, as I will draw, what happens in atrial systole, the atria contract and they give the final push of blood. I'm going to draw that with thicker arrows to show that a contraction occurred and provided the final 20 to 30% of ventricular blood volume into the ventricles. It will be represented by thicker arrows. So this is not passive, this is active filling because the atria actually contracted. This contraction ensures the ventricles are completely filled and ready for the next beat. The term given to the volume at which the ventricles are completely filled is the end diastolic volume. I just want to make note of the fact that throughout the whole ventricular filling, both passive and active, as the atrioventricular valves are open, the semilunar valves are closed. They are closed because their pressure is lower than in the aorta and the pulmonary trunk. The ventricles are filled and they are now ready to contract. In the next video, we'll enter ventricular systole, where the ventricles start contracting to push blood out of the heart. But before we finish this video, let's quickly summarize the key points from ventricular filling and atrial systole in a simple table. This is a summary for the diastolic phase of the cardiac cycle. Early diastole is passive filling, where the ventricles fill as they relax. AV valves open and semilunar valves remain closed. This accomplishes about 70 to 80% of ventricular filling. In late diastole, atrial systole tops up the ventricles. The AV valves stay open, the semilunar valves remain closed. And this adds the final 20 to 30% of the ventricular filling. This wraps up ventricular filling and atrial systole. In the next video, we'll move into ventricular systole, starting with isovolumetric contraction. See you in the next video.